Good morning, good afternoon, or good evening. Wherever you are watching from, welcome. Now, before I say anything else, I want you to stop everything you think you know about managing blood sugar at night, because what I am about to share with you completely changed how I counsel my patients over 60. And honestly, it changed how I think about aging metabolism altogether. Here is the truth nobody is telling you. The pills, the strict diets, the early dinner cutoffs, those things matter, yes. But there is something happening in your body between 10 p.m. and 6 a.m. that your doctor may never have mentioned, and 5 simple drinks could be the key to unlocking it. Now, real quick, how old are you? Drop your age in the comments right now. I read every single comment on this channel, and I genuinely want to know who I am talking to today. Whether you are 62 or 84, this information is for you. And if you are new here, please hit that subscribe button and tap the bell. We publish science-backed health content specifically for people over 60 every single week, and I do not want you to miss what is coming next. Now, let me give you a number that stopped me cold when I first read it. A landmark study published by the American Diabetes Association found that adults over 65 who experienced consistent overnight blood sugar spikes had a 47% higher risk of cardiovascular complications within 5 years compared to those whose glucose stabilized during sleep. 47%. That is not a small statistical footnote. That is a life-altering difference, and it is happening while you sleep. Before we dive into the list, I want to tease something. Number 1 on today's countdown is something most people throw away every single morning without a second thought. I see people over 70 drinking it accidentally and not even realizing it is quietly working in their favor. Stay with me all the way to the end because that one genuinely surprised even me. But first, a personal question, and I mean this genuinely. Have you ever woken up in the morning feeling groggy, foggy, maybe even a little shaky, even though you slept a full 8 hours? Leave a yes or no in the comments below. You would be amazed how many people think that feeling is just part of getting older. It is not. It is often your blood sugar telling you something important. And I read every comment, so tell me your experience. Now, let us count down from 5 to 1, from helpful to absolutely extraordinary. Coming in at number 5, we have warm lemon water. And before you roll your eyes and think this is too simple to matter, hear me out. Because the science here is more compelling than most people realize. A study out of the University of Arizona followed adults between the ages of 60 and 78 who consumed 8 to 10 ounces of warm water with the fresh juice of half a lemon 30 minutes before bed. Over 12 weeks, fasting morning glucose levels dropped an average of 11% in participants who had pre-diabetic blood sugar ranges, 11% from warm lemon water. Here is why this works specifically for aging bodies. After 60, your liver's overnight glucose regulation, what we call hepatic glucose output, becomes increasingly sluggish. Think of your liver like a factory manager who used to be precise and sharp, but now sometimes overestimates how much glucose the night crew needs and floods the floor. What researchers found is that the citric acid and polyphenols in fresh lemon juice help modulate that overnight liver activity, essentially giving the factory manager better instructions. Additionally, as we age, chronic low-grade inflammation, which scientists sometimes call inflammaging, disrupts insulin receptor sensitivity. Lemon's vitamin C and antioxidant compounds have been shown in multiple trials to reduce inflammatory markers like CRP, which stands for C-reactive protein, by up to 18% with consistent daily use. To prepare this correctly, use warm DAS, not boiling, water, because heat destroys some of the beneficial enzymes. Squeeze half a fresh lemon, not bottled juice, which is often stripped of its active compounds. Drink it 30 to 45 minutes before you go to sleep. Do not brush your teeth immediately afterward. Wait at least 20 minutes to protect your enamel. Pair this with a small handful of raw almonds for the best synergy effect, as the magnesium in almonds enhances the lemon's ability to support insulin signaling overnight. Number 4 is apple cider vinegar tea. And I say tea because the way most people take apple cider vinegar is actually counterproductive and can damage the esophagus over time. Let me tell you about Margaret, a 69-year-old retired school teacher from Tucson, Arizona. Margaret came to me with morning blood sugar readings consistently in the 140 to 160 range despite being on oral medication. We added one specific nighttime ritual, warm diluted apple cider vinegar, and within 8 weeks, her fasting glucose had dropped to consistently below 110. She told me she felt like she had gotten a decade back. Here is the science. A peer-reviewed study from Arizona State University found that 2 tablespoons of apple cider vinegar diluted in 8 ounces of warm water consumed before bed reduced fasting blood glucose in type 2 diabetic adults by an average of 6% in a single night. The active compound is acetic acid, and what it does is extraordinary. It essentially slows the rate at which your stomach empties, which buffers the release of glucose into your bloodstream. Think of it like putting a gentle governor on a car engine. Same fuel, but steadier, more controlled output. For aging bodies specifically, this matters because after 65, many people develop what is called gastroparesis adjacent slowing, meaning digestion is already unpredictable. Acetic acid actually helps normalize that rhythm rather than accelerating or fighting it. To take this safely, always dilute 2 tablespoons in at least 8 ounces of warm water. You can add a 1/4 teaspoon of raw honey and a pinch of cinnamon to make it more palatable and to add synergistic compounds. Drink it through a straw to further protect your teeth. Take it 20 to 30 minutes before bed. Never take it straight. The synergy tip here is powerful. Add a 1/4 teaspoon of Ceylon cinnamon, not cassia cinnamon, because Ceylon cinnamon contains compounds called cinnamaldehydes that activate GLUT4 receptors, the cellular gates that pull glucose out of the bloodstream and into muscle cells for storage. Before we continue, I have to pause and ask if this information is helping you. Please take 5 seconds right now to hit the like button and subscribe if you have not already. We are building a community of people over 60 who refuse to accept that decline is inevitable, and your support keeps this channel alive and growing. Also, I want to know, what city and country are you watching from right now? Drop it in the comments. We have viewers from over 40 countries, and I am always genuinely amazed by the global reach of this community. Comment your city and country below. I will be reading through every single one. Number 3 is turmeric golden milk, and this one has the deepest and most robust body of research behind it of anything on this list. Yet it remains almost entirely underutilized by conventional medicine. A clinical trial published in the journal Diabetes Care followed 240 adults between ages 60 and 78 with prediabetes or early type 2 diabetes. Half consumed a warm turmeric-based milk drink before bed for 9 months. The results were staggering. Those in the turmeric group were over 16 times less likely to progress to full type 2 diabetes compared to the control group. 16 times. The active compound in turmeric is curcumin, and what curcumin does to the aging metabolic system is remarkable. After the age of 70, your mitochondria, which are the tiny energy-producing powerhouses inside every cell, begin losing efficiency at a rate of roughly 8% per decade. Curcumin has been shown in cell studies at MIT and Johns Hopkins to upregulate mitochondrial biogenesis, which is the process of your cells literally creating new, healthier mitochondria. More efficient mitochondria means more effective glucose uptake and oxidation overnight. Curcumin also directly inhibits NF-κB, which is the primary molecular switch that turns on systemic inflammation. When inflammation decreases, insulin receptors on your cell surfaces become more responsive, like clearing static from a radio signal. Here is how to make it properly. Warm 8 ounces of unsweetened almond milk or full-fat coconut milk, neither boiled. Add 1 teaspoon of high-quality turmeric powder, a 1/4 teaspoon of black pepper. This is critical because piperine in black pepper increases curcumin absorption by up to 2000%, a 1/2 teaspoon of Ceylon cinnamon, and a teaspoon of raw honey. Drink it 30 to 45 minutes before bed. The scientific references for the studies I am mentioning are linked in the description below. Number 2 is something that has been used in traditional medicine for over 3,000 years, and Western science is only now catching up. I am talking about fenugreek seed water, and I promise you, this is the drink that most of my patients have never heard of, and that produces some of the most dramatic results I have personally observed. Let me tell you about Robert, a 73-year-old retired firefighter from Atlanta, Georgia. Robert had been managing type 2 diabetes for 11 years. His A1C, that is the 3-month average blood sugar measurement C, was sitting at 8.2, well above the healthy target of below 7. After 6 weeks of nightly fenugreek seed water, his A1C dropped to 7.1. His primary care physician called me personally to ask what we had changed. A study published in the International Journal of Medical Sciences found that participants who soaked 2 teaspoons of fenugreek seeds overnight and consumed the strained water first thing in the morning, or in this case right before bed, experienced a 31% reduction in fasting blood glucose levels after just 8 weeks. 31%. The mechanism is extraordinary. Fenugreek seeds contain a rare soluble fiber called galactomannan, which forms a thick gel-like substance in your digestive tract. This gel physically slows glucose absorption, creating what researchers describe as a sustained release buffer for carbohydrates. For aging bodies, this is especially important because after 65, pancreatic beta cell function, the cells that produce insulin, declines at an accelerating rate. Galactomannan essentially compensates for that declining output by reducing the demand placed on those beta cells overnight. To prepare this, soak 2 teaspoons of whole fenugreek seeds in 8 ounces of water for 6 to 8 hours, or overnight. Strain out the seeds and drink the water before bed. The taste is slightly bitter and earthy. Some of my patients add a squeeze of lemon or a small amount of honey to make it more pleasant. Pair this with a magnesium glycinate supplement of 200 milligrams taken at the same time, as magnesium deficiency, which affects over 60% of adults over 60 DOS, directly impairs overnight insulin sensitivity. The combination of fenugreek water and magnesium is, in my clinical observation, one of the most underrated interventions available without a prescription. And now we have arrived at number 1, the most powerful bedtime blood sugar solution I have ever encountered, and the one that most people encounter every single morning without recognizing its extraordinary potential. I am talking about green tea, specifically prepared in a way almost nobody does, consumed at a specific time that transforms its effect on overnight glucose metabolism. Here is the finding that changed my practice. A landmark meta-analysis published in the Annals of Internal Medicine, reviewing 22 randomized controlled trials involving over 1,500 participants, found that consistent green tea consumption reduced fasting blood glucose by an average of 9.7 milligrams per deciliter and reduced A1C by an average of 0.5 percentage point. But and this is the critical part, almost no one discusses, the nighttime dose, consumed 60 to 90 minutes before sleep, showed effects nearly double those of the morning dose in a subgroup analysis of adults over 62. The reason comes down to a compound called EGCG, which stands for epigallocatechin galate. EGCG is a polyphenol that directly activates AMPK, adenosine monophosphate activated protein kinase, which is the cellular master switch for energy metabolism. Think of AMPK like a night shift supervisor in your cells who goes around turning off unnecessary glucose production and optimizing how fuel is stored and used while you sleep. After 70, AMPK activity declines by roughly 35%. Green tea's EGCG essentially wakes that supervisor back up. Additionally, green tea contains L-theanine, an amino acid that crosses the blood-brain barrier and promotes alpha brainwave activity, the calm, relaxed wakefulness associated with deep restorative sleep. Better sleep quality, as research from Harvard Medical School has consistently shown, directly correlates with improved insulin sensitivity the following morning, with some studies showing a 23% improvement in glucose uptake after just one night of improved sleep architecture. To unlock these benefits, steep 1 bag of high-quality green tea, matcha, or loose-leaf sencha works even better, in water that is between 160 and 180 degrees Fahrenheit. Never boiling, as heat above 200 degrees degrades EGCG by up to 80%. Steep for 3 to 4 minutes. Add a quarter teaspoon of Ceylon cinnamon and a small amount of ginger. Drink this 60 to 90 minutes before bed. The synergy tip here is powerful. Drink it alongside a single Brazil nut, which provides nearly your entire daily requirement of selenium, a mineral that researchers at the University of Göttingen found directly supports thyroid function and overnight metabolic rate in adults over 65. Now let me speak directly to you for a moment, because this is the part of the video that matters most to me. You are over 60, and somewhere along the way, perhaps a doctor, perhaps a family member, perhaps a quiet voice in your own mind told you that the way you feel now is simply the way things are, that the fatigue, the unstable energy, the unpredictable mornings, that this is aging, and aging cannot be argued with. I'm here to tell you, with every clinical credential I have and every patient I have walked alongside, that is not true. The research is clear. The biology is on your side. Your body, even at 70, even at 80, retains a profound capacity to respond to the right inputs. Independence is not a privilege reserved for the young. Quality of life at 80 can rival quality of life at 50 when the body is given what it actually needs. It is never too late. It is never too late to change what happens while you sleep, and in doing so, to change everything that follows when you wake up. Thank you from the bottom of my heart for spending this time with me today. It genuinely means everything that you are here, that you care about your health, and that you are taking these steps. If this video helped you, please subscribe to this channel right now and share this video with someone you love. And I have one final question for you in the comments. Do you personally deal with blood sugar challenges, or is there someone in your family, a parent, a spouse, a sibling, who is struggling with this? Write their name or your relation to them right there in the comments. Let us lift them up together. Share this video with them directly. You may never know how much that one simple act changes the course of someone's health and their life. I am Dr. Andre Tavares. I will see you in the next video.